So Crystal and I today are going to be talking about the importance of language and the words that we use when working with participants in the CSE for FEP program, but by extension, all people that we might be working with, and taking a look at some things to keep in mind when we talk about language and the words that we use. So I'm going to start off, and there's a quote here. I'm going to read it because I think it is a very powerful quote that I got from the Mental Health Coordinating Council in Australia, and I'll talk a little bit more about that as well. It says, "Words are important. The language we use and the stories we tell have great significance to all involved. They carry a sense of hope and possibility, or can be associated with a sense of pessimism and low expectation, both of which can influence personal outcomes." And I think that this quote really highlights the impact that words can have, particularly with those individuals that are seeking help with their recovery. Based on the words that we use, it can influence outcomes. It can either be empowering to participants and individuals, or it can be harmful and destructive to their recovery efforts. So the MHCC developed a recovery-oriented language guide, and it'll be something that Jamie will be able to send out to everyone to kind of take a look at it. But it highlights the power of words and language. And so just some examples in thinking about the language that we use, and it represents the meanings that we have constructed from our experiences and what we have gone through. It prompts attitudes, expectations, and actions. And I think that this is really important to think about when we're working with individuals, in that the words that we use have a tremendous amount of influence on what our attitudes are, what our expectations might be for individuals that we're working with, and it will come out through our words. And we always want to consider and reflect unconditional positive regard, right? Because, and I know I've heard teams talk about this frequently during team meetings, that no one should be defined by their mental health and should always be respected as individuals first and foremost. So this, I think, from the recovery language, or the recovery-oriented language guide, it highlighted a specific section where it talked about when working with individuals and they may be taking steps to or making attempts to reclaim a sense of power in their lives, or have a sense of control in their lives. And sometimes providers can misinterpret those efforts as being some of the things that are included on this slide here, talking about things like manipulation or oppositional, borderline types of comments that are sometimes thrown out there, when perhaps it is an effort on the individual's part to gain some sense of control of the things that are going on in their life. And so we want to keep that in mind. The recovery oriented language guide talks a little bit about how, from a mental health system point of view, that oftentimes it is viewed, and Crystal and I will talk about this as well, mental health services are often viewed as a hierarchy. So participants oftentimes view therapists, case managers as those with power and control over them. And so we want to kind of keep that in mind when we're thinking about the language that we're using. So Crystal's going to talk a little bit more about stigmatizing language, and when that language is shared through something, for example, like electronic health records, and how that can play a role on discrimination and impact care. So, for example, if I am in a role as a case manager and I am reading something about a participant in the electronic health record that a therapist has put in, it's going to have an influence whether I know it or not, whether it's a conscious influence or not, it's going to have an influence on how I may potentially view the participant when I meet with them. And so Crystal's going to talk a little bit about that, but I think Sun and colleagues here, they highlight some of the consequences of what bias and discrimination can have with care, particularly with engagement and particularly with follow-up. So thinking about things, if participants have had experiences with discrimination, especially racial discrimination, they may be less likely to seek care or more likely to delay care. And then also less likely to follow recommendations. If there's that distrust that's present, they may not be as maybe open to suggestions, feedback, recommendations that the provider might be giving to them. So all things we want to keep in mind of the potential biases and discrimination that could occur as a result of the language that we use. Okay. I am going to tag Crystal in. She's going to take it from here.
All right, thank you, Nick. So I am just going to spend a few minutes talking about language and medical records. Next slide, please. As we're thinking about stigmatizing language, as Nick already introduced, African-American patients were 2.5 times more likely of being described with one or more negative descriptor. And the concern is that racial bias, and I would say bias in more general, continues to be transmitted throughout the electronic health record. So Sun and colleagues were specifically looking at history and physical, and most of the records they looked at, the history and physical was just copied. So it was just copied from note to note. So if we think about the bias that's being transmitted, something that a provider writes today is going to be in that record 6 months from now, a year from now, 5 years from now. And while it is important to think about self-awareness and training, as we know that can't just have one training and then all of a sudden things change. And so Sun and colleagues, they also get us thinking about more kind of some of that higher level practices as well. So all the responsibilities, not just falling on at the individual level, but also thinking about how can we weave this into our policies and procedures. Next slide, please. So some of the major themes of negative language was questioning credibility. So an example is seeing someone in pain, but not believing them. So essentially seeing it in a negative light. The issue is then the most aggressive treatment is not always provided. So we want to stress it isn't just about being kind. I mean, it is about honoring one's humanity, but also how does this impact one's quality of care? I thought the expressing disapproval of self-care was interesting just because a lot of organizations are really stressing self-care. But then want to also, something Nick said earlier made me think about this emphasizing authority over the individual. So individuals reported they sat in this appointment, but ultimately left feeling like a child. So feeling like they didn't have any power, didn't have any say in their treatment, leaving there also just feeling stupid. And that can potentially impact retention rates, because if someone is leaving this interaction and they don't feel heard, they're leaving feeling like a child, then that might significantly decrease the chance that they're going to return to that provider or that organization. Next slide, please. And this slide just summarizes what we were just talking about on the last 2 slides, but just really want to highlight, I think, in a moment of time and, maybe someone is going through having a bad day and you write something, thinking about, again, how that whatever it is, how that remains in that individual's chart and how that continues to follow them as they move through the healthcare system. And so as we can, thank you, as we start talking about considerations, I did think it was important to acknowledge the many concerns within the system. So recognizing that all of us as individuals also live and work within systems. And so, what was said, with Sun and colleagues and Park is that healthcare systems can lead to, increased implicit and explicit bias. And that's important. We want to believe that many people, most people, are well-meaning, but some people do bring their own like explicit bias into their work environment. And so, when you have increased caseloads and decreased staffing, it's not as if those issues cause bias. Oftentimes that bias is already there, but it just increased in whether it's the record, so the actual documentation, or the interaction with the participants. And, issues within the system also can lead to emotional frustration as well as burnout. Next slide, please. Something that we can do on an individual level is just using everyday language and also trying as much as possible to match the language of the individuals that we're working with. An example is just simply using the pronouns in the name provided by the participant. What we know from the Trevor Project is youth and young adults that have their pronouns and their names affirmed, they actually have, it decreases their thoughts of suicide. Always encouraging, that collaboration, that openness, but also just some curiosity. If you don't know, ask, and that in itself will make the participant think that you're curious, you want to know more, and can increase some of that respect and kind of continue that relationship building. And something all of us probably need to work on from time to time is coming from a more just an asset framework in general. And it could be something as simple as instead of saying someone is mentally ill, a person is diagnosed with. So whatever that diagnosis is, that also leaves the individual some autonomy, within the situation that they can kind of, again, feel like they're the ones in control. They have a little bit more of power in regards to how they accept said diagnosis. And our last slide. So as we wrap up, I want to stress that it is about the language, but it's not just about the language. As we're thinking about many individuals that are coming through the doors of your organizations, I'll be honest, I continue to be amazed by just how, they're able to survive and maneuver, many difficult situations. And so they don't always see it, but sometimes then we have to remind them, just how powerful and capable they are. And that concludes our presentation on language.